Hi everyone. So I'm digging in. I'm going to make this video about my 10-year struggle with skin cancer. So if you don't want to hear gross details, or you're kind of queasy, or this is not your type of video, just scroll by and I'll make something a little bit more fun in the upcoming weeks. So my name is Honor Stark, and I've had a channel on YouTube for I think about 2 years now, and I've really enjoyed it. And I asked my friends, I put out a poll, any tips or any advice, or what would you like to see, what kind of content? And overwhelmingly, I was asked to post about my experience with cancer. Now it's interesting because as I was thinking about doing this video, I really don't talk about the hardships that come along with cancer. I generally, I am a pretty positive person anyway, but I generally don't talk about how hard it is and how it's really affected my life. It's changed my life and how I live my life. And so here's an opportunity to just be vulnerable, be real about it, and I'll let you know what my experience is. I know so many people have cancers that are just so deadly, so unbelievably difficult, and I feel a little shameful that I'm making a video on my cancer, because my cancer is controllable to a certain extent. So I'm very grateful for that. Nevertheless, it is something that I will live with for the rest of my life, and so I've had to really adopt a very positive outlook. I have to keep fighting it every couple of months or twice a year, and I have this daunting cancer hanging over my head forever. So it's a lot to take in, it's a lot to live with, but I think that I'm doing a fairly good job and improving all the time. So let's get into a couple of facts, because I got out my book and I wrote some stuff down. So my diagnosis is I have basal cell carcinoma, or short form BCC. I have an aggressive form of BCC. It's one of the most common cancers, skin cancers, and what it does, it can come in all kinds of different forms. It looks different. There's so many different ways it can manifest in your skin, on your body. It mostly happens for fair-haired people. For redheads, it's pretty deadly. It's because my skin is just so fair. I have it here in my scalp, all over my face, chest, arms, legs, and feet. So I have it everywhere. I don't have a lot of skin on my body that is considered healthy skin. So my treatment will vary from other people's treatment. My experience will be completely different than someone else's who can go in and have their basal cell cut out. That would be a dream if I could do that. That would be awesome. So, so the different types of what you may see on your own body when you're checking. I'm just looking at my iPad for some reference. You could see small lumps, little lumps that come in the form of a pearly little pimple. Like it looks like a pimple, but it won't go away. And you might see tiny blood vessels in there. Also, something that's pretty uncommon is something called waxy skin growth. Now, I'm going to be tested for this because on the top of my forehead, a lot of how I tell when a new tumor or lesion, it's tumor or lesion, it doesn't matter. The two definitions are interchangeable. So lesion sounds kind of weird to me. I'd rather use the word tumor. But I have a feeling on my forehead that it doesn't feel like the rest of the skin on my body, whereas it's a little bit more rough. Doctors often misdiagnose BCC for eczema, dermatitis, and I think that's part of my experience too. So this is going to be checked. I have an appointment with my physician next week, and we're doing a whole workup. Just to let you know, I've got lots of cats, and they're all gonna come and say hi. That's okay. I'm talking about the big bad cancer. So, oh yes, I'm glad you like it. Next part, another symptom of basal cell is an open sore. So you can have an open sore on any part of your skin that just will not close. For example, I had a significant tumor here on my forehead, and it would not go away. It looked like awful red bleeding. It wasn't quite open, but it was it was the size of a quarter, and it was scaly, and of course I'm exfoliating my face and I'm bleeding all over the place, and it just got worse and worse, and then my skin actually indented, so you could it was getting very close to the bone, which was scary. So there's so many different symptoms. There's open sores, there's the waxy skin, there's little pink marks, there could be dark marks. This looks like an age spot to a lot of people, but for me, it's not. It's cancer. So what happened with my experience in 2009, as I said, I noticed that there's this very, very large portion on my forehead that was really scaly. It was red. It looked angry. I was, just going into my 40s, and I was probably 38 when I noticed the skin being flaky and sloughing off. I neglected to go to the doctor because I thought skin cancer would look like skin cancer. It would look different, like a dark black spot, and it was like a one size fits all. So when I finally did go to the doctor, I had an idea that there was something wrong, but I never thought for a million years that she would say to me, the dermatologist, that I have cancer. The way it was delivered to me, she was very, her bedside manner was very cold, and it was very difficult for me to hear, yes, that's cancer. We'll do a biopsy and we'll come up with a plan, but yes, you have cancer. And it was just like that. I must have been sitting in her waiting room or in her office for maybe 10 minutes. She made me disrobe. I had to show her the bottoms of my feet. I had to show her my entire body. Thankfully, I didn't have any signs of any other more deadly cancers. And so she said, you'll need to go and have surgery and come up with a treatment plan. So I was so shocked and so afraid, I completely shut down. I had to go back to my 4 children at home after this appointment, and I could not, absolutely not, show them how terrified I was and how devastated I was, because it was all big and scary. So because I knew that I had to have surgery, and at that time they wanted to cut it out, thinking that would be the best option for me. So I requested to have a plastic surgeon who he will do the surgeries for my face, but he also deals with cancer patients. So I'm extremely lucky that I have Dr. Wayne Carmen, and he works out of Scarborough General Hospital, and that Dr. Wayne Carmen and Sunnybrook Hospital basically have the same treatment plan for me today. So I'll back up a bit. So I went in and I had the consultation, and Dr. Carmen, it took 7 surgeries to get rid of this one tumor. So it was up in my hairline, and you have to look very carefully, right? The tiny scar. This is a biopsy scar, which Dr. Carmen didn't do. So another doctor did that and left a scar. But he removed all of this. It was just fantastic how he made it a lot easier for me, so I don't have to look at a battle scar all over my face. Now, I have an aggressive form of BCC, whereas I have it everywhere, and I have the skin probably of an 80-year-old woman because of the burns that I received even before I was 13 years old. In the 70s, we did not use sunscreen, and my mother did her very best to cover me up, but I mean, that wasn't part of our lifestyle. So what happens, it takes so long for these tumors to actually come up to the surface. And when we were closing up this first tumor that we attacked, you take a biopsy on either side and to knit the skin together, and hopefully you have what they call clean margins, where you don't have any cancer cells left in the skin, and it's safe to close it up. I don't have that. All of this has cancer. So I don't have any good skin left to cut out. So I can no longer have surgery on my face. I could probably do a lot of coverage on my arms. So we've developed at Sunnybrook Hospital and with Dr. Carmen, we got a recommendation to go and see about radiation. I'm not a candidate for radiation either. I have too much cancer. It's not just one localized spot or one localized spot here. It's just everywhere, and it will continue to come up. And I was told that I think it was in 2010, after a year of aggressively treating this big tumor, that I had better get used to this becoming my life, part of my lifestyle. This cancer is a part of your lifestyle, Honor. It's not going to go away. So even though I have really aggressively treated this, it comes back. So because there's just more underneath the skin. So thankfully, there is a treatment protocol that I have been following that has up to a point been very successful. And it is a chemotherapy treatment cream. I have little bags and stuff here because I'm all organized. So I'm not going to show you what the medication is because I don't want to be the person on YouTube saying get this stuff, because it's up to you and your physician. But I basically have this, and I also use some lidocaine cream. And what it does is a tiny bit of cream, you can't get it near your eyes or your mouth. You don't want to put it anywhere sensitive. Wash your hands like a crazy person under your nails, and or use gloves to apply it. I can put it here on my hand, and if I don't have any cancer cells here on my hand, there will be no reaction. However, if it picks up, if I do have cancer on my hand, or it'll pick up all of it. So there's a spot on my face that you could probably see. I'm on purpose not wearing any type of foundation here. There's still a red indentation from the cancer that was here on my face. Now, it's not something that bothers me at all. I notice it, but I am so grateful that it healed so well. We put it on my face, so I just would dot it, and you do it once a day. And what happened is the cream spreads. It just naturally spreads, and so it picks up and it picks up and it picks up. So you put it on every day. Some doctors want you to put it on every 3 days, or and different types of same medication, but different types of application. For me, my doctor's like once a day for 3 weeks, 2 weeks, 3 weeks, depending how long I can actually handle it. And so I had a very, very large, lots of my friends have seen pictures of my face in a very large, pronounced scab. So it goes, this cream goes into your skin, right down to the bone, and it kills off all of the cancer cells. And what it does is that your skin sloughs off. So it's really gross. It's really, really gross. It's very painful, and it's hard to deal with because it's the first thing that you look at, and it's hard when your face is so disfigured and malformed. It's a very hard thing to get over and have that belief that you're a good healer, and regardless of any scars, everything is going to be okay. So basically, that's been my experience with these treatments. Sunnybrook wanted me to put the treatment on for every day for 3 months, or every other day for 3 months. And I said, no, I'm not doing that. I have such a reaction to this medication. I am the healthiest person, physically and emotionally pretty healthy also. But I tell you, by the 3rd day of putting the chemotherapy cream on, I just get sick. So I have all kinds of wonderful little things that I must use while I'm in treatment. So sometimes the itching just gets so bad, it feels like little red hot ants wherever the tumor is on my body. It feels like hot, burning, biting ants. It hurts, but it itches, and it's itches, and it's crazy itchy, crazy itchy, but you can't touch it. You can't get it dirty, you can't get it infected. So sometimes I do break down and put down like an anti-itch cream, and that does help, but it just gets mixed in with the dead skin that's falling off, and it's really kind of gross. So I have to be like desperate to do that. Benadryl is my friend. Visine. I have had, even though I wash my hands extremely well, I have touched the corners of my eyes to scratch, because you're always touching your face. And regardless of how well I've washed my hands, sometimes the cream has gotten into my eyes and infected them. So I give them an extra wash. So here's the fun stuff, the stuff that I don't talk about. It makes me feel like I have a very serious flu. So I don't always make it to the bathroom on time. My stomach is very upset, and it's, really hard to deal with when you feel sick and you know, you have a bowel movement and you're just so sick and cleaning yourself up. But that's not as common, but it does happen. Feeling like exhaustion. I can't think, I can't speak, I can't figure out my daily life. Like, is Karis okay? What's Jesse doing? And Dakota, they must miss Mommy. And, you know, little Joni, and I'm scaring the shit out of my mother. I know it. So I have all of these panic things going on because I feel so out of control. And for me, feeling out of control is the worst thing. My mind just goes into terrible places, that I am not doing a good job parenting. I am not doing a good job trying not to scare the hell out of my mom. She's already lost one child. She does not need to know and be with me while I'm sick in treatment. So I have all of this guilt. I have all of these regrets of not covering up when I was in my 20s, but I'm not really that hard on myself because I'm a redhead. I would get a sunburn sitting inside a window, like indoors through a window. So, but the symptoms, and the most difficult part is that I can't think properly, and that means I can't emotionally connect to people around me that I love. I can't communicate my needs. I can't say, oh, I'm feeling this, or I need that, or I just bully through it. And I am so determined to kill off each tumor and get it done. And it doesn't matter if I have a migraine. It does not matter how sick I am. I complete the treatment, I do it, and I do it over and over again. And I will do it for the rest of my life because this is not going away. The reason why I have that attitude is that if this gets to my bones, if it gets into my lymph nodes, if it travels, the likelihood of it traveling is pretty minimal, but it does happen. But it's not gonna happen with me. I'm gonna treat it aggressively as I do every single time. Now, we have run into a few issues with the topical not working. I did already, not that spot, I already treated up here, and I treated another spot back here just in March, and some parts on my arm, and I can still see that they're there. Now, it's not a different type of cancer, it is basal cell, but the longer it stays on my skin, the better chance it has of spreading. So I have to hit them hard when I see them, and they come up so quickly. I had just this one 6 months ago, and now I have that one. So next week, hopefully he'll just cut it out. I'm hoping. But if you have any questions, let me know. This has turned into a long video, but I guess it's important to acknowledge why I'm positive. I've always been a positive person. I've never been a bitter, angry person. I've had a lot of loss in my life, a lot of sadness. I do have severe anxiety and PTSD. That doesn't make it a lot easier to deal with a life-threatening disease for the rest of my life. But I actually feel grateful that I have this kind of cancer, that I do have the tools. I have the most loving support system ever. I have a partner who will take care of me all the time, anytime. My children absolutely they go above and beyond when it comes to loving me and helping me. And that also is that also is very hard for a mom to have to depend on her children to take care of her. Like that to me is the opposite kind of mom I want to be. I worry that, you know, the role model I was for my eldest, you know, boys, I was very strong, capable, very wordy, very loud, very strict, and they, of course, they took care of me when I had a migraine, or like we took care of each other when we were sick. But now, Kiki, my baby, I think she just thinks her mummy's fragile, and I'm not. I think that I'm very powerful, and I keep fighting. And even though I get sick for months at a time, I will keep fighting. And when I'm better, like I am now, I haven't been in treatment for a couple of months, so my brain is working perfectly, except for that, you know, crazy part of me that has problems with my brain anyway. But it's a challenge, and it's an opportunity for me to grow. I really don't want it spreading. It's something that I think about all the time. The risk that I have with melanoma, every 3 months, every 3 to 6 months, I have to really think about it and worry about it, because I have to get checked, and I'm at an incredibly high risk for melanoma. And I don't want 2 cancers. I'd like to stick with just the one. That's all I can handle. So it's hard. It's really hard to know that you're never allowed in the sun for the rest of your life, that you have to be almost like a vampire, because I can't go out. Phone's ringing. I can't go outside when I'm in treatment. I have to stay home. I'm so susceptible to all different, you know, like coughs and viruses and infections. And if I get a secondary infection, I'm just so much more sick. So it's a complicated process, and I keep it light. I always keep it light, because I think that it's easier for me, so people don't know how sick I am or how sick I get. And I also feel that other people have a horrible time, like 10 times worse than me, that I feel like you have options on, or you have a treatment plan. You can, you know, get rid of a tumor at a time. It's not gonna have a chance to spread because you're fighting it so hard and quickly. So I have such empathy for the folks out there that have cancers that are just so aggressively deadly. My heart just goes out to them, and I can't imagine having to deal with that. So I guess that's why I don't really, you know, get into how I feel, how scared I feel all the time, because I'm scared a lot of the time. Every single time I go and get a biopsy, I don't know which cancer it is. I know it is a cancer, but that word, I think that word gets easier to use after a while. After 10 years of doing this, I think the word cancer for me is I don't know, it's easier now. But it's because I'm used to the type of cancer I have, and I have not let it spread, thank goodness. It hasn't gone to my lymph nodes, my bones, high risk to bones, or other tissues. So we don't want any of that. So that's me. That's the cancer. And this is what I generally don't talk about. But I think that, you know, if you have a good foundation, that's the last thing I wanted to say. My foundation in life is excellent. I live in a safe, peaceful, loving home. It is warm. I have food in the fridge. I love it. I love my surroundings. I feel safe and wonderful here. I have people around me who love me, who are so loyal to me and have my back, and as I have theirs, and that is a very rare commodity. That is the number one thing for me, is loyalty. You don't walk away from people when they're sick. You just don't. You walk toward people and you give of yourself. And I believe that I have that in my life every day. And that's why I am so loyal and kind to others, because I receive it. So my foundation is good. I have a really healthy diet. I don't drink. I don't smoke. I quit smoking in 2014, which was so hard. And I really liked it. I don't know why, but having that smoke was my rebellion in life. But I gave it up. I vape, but I don't have any nicotine in the vape, and that's gonna be going too. It was one way to make me quit, and I took it. So, having all of this foundation makes the times when you're really, really, really sick something to focus on, something positive to think about. I count the days. I go through in my mind the birth of my children. When I'm very sick, I think about the labors. I think about the first time I held them. I think about my late brother and how much comfort that gave me, and how he protected me, and he was wonderful. I think about my partner. I think about all of the gifts that I have, and that just makes me power through. But honestly, I need to be a role model to my children. I think the greatest gift that I can be to my children, even though they're adults now, is to show them what to do when shitty things happen, how to work through it, and how not to give up, how to just talk about feelings, talk about how scary it is, talk about how shitty it is. And bad things happen. Bad things happen to good people. And it's how you respond to those situations that matters in life. And those are the lessons. And I want to help teach them those lessons by doing really, really good things when shitty things happen. So I know I frighten the kids every time that I'm in treatment. I know Karis cries every single time. Begs me not to go into treatment because I'm so sick and she needs her mom. And she's almost 18 and she cries every single time. And I don't blame her one bit, not one bit. The big boys, Jesse and Dakota, they can't even bear to see their mother so sick. I don't get into the details. Hopefully they won't watch this video because I'll gross them out with my stomach issues. But I can't tell them, I can't tell them how sick I am and what that may feel like, but they acknowledge, how are you feeling, how's today? But when my face is literally sliding off and it's pussy and it actually smells, because it does, it's so gross, they can't bear to look at their mom in pain like that. And Jonas puts on more of a stiff upper lip, but I think he's the same as the big boys, but he can look past the big scars and the big oozing stuff on my face or on my body, or what's if I'm too sick and I'm vomiting, or I've made a mess. He wouldn't, that wouldn't bother him. Karis puts me to bed, rubs my feet, brings me water, kisses my forehead, holds my hand, and all I want to do when my eyes are closed and I'm not sick, all I want to do is cry, and you just want your mom, But I am the mom. And here's this little gorgeous kid just holding my hand. So anyway, long video. But it's helpful for me to talk about it, and I hope that other people who have basal cell will have an appreciation that, you know, it's not, I'm not going to say it's not the end of the world. It really is not great. And you need to be careful. You need to treat it. Otherwise, it will spread. But it isn't aggressive and deadly as melanoma. And when people say, oh, yeah, okay, you only have that kind of cancer, that really annoys me, because I understand what kind of cancer I have. I understand how aggressive my cancer is. I know the risks. I've lived with it for 10 years, and I will for the next 30, 40 years of my life. So please save your judgment. I know it's not, you know, a horrible lung cancer and I'm leaving in 2 weeks. But from my experience, I have to take this in stride forever. And I don't think it's a fair statement to say, oh, it's only that kind of cancer. You don't look like you have cancer. I get that too. Oh, yeah, you look great. I don't lose my hair. I am grateful for that. I just lose my skin and my face and stuff. So hopefully I've answered everyone's questions. I think probably more than needed. If you have any questions, I'm going to be posting this to Instagram link. I'm going to be posting it to Facebook, and of course uploading it to my YouTube channel. Thank you for requesting this video and making me talk about the difficult things, and making me learn a little bit about myself in the process. So leave me a comment, hit the like button, and we will see you on social media. Bye.